Welcome to our fourth episode. This is Care for a Healthy You. This month we will be discussing advanced directives. At the end of our time together, we hope everyone has a better understanding of the advanced directive process. Hi, I'm Chad Waterman. I'm the Assistant Administrator here at Care 1 at Lexington. I'm here with Dr. Amanda Burling. Dr. Burling is a board-certified internist and geriatrician affiliated with Mount Auburn Hospital. She completed medical school, internal medicine residency, and a chief residency at the University of Michigan, then her geriatric training at the Harvard Geriatric Fellowship Program. Her practice involves an outpatient clinic where she sees primary care patients over the age of 65, as well as consults primarily related to dementia evaluation. She follows her own patients when hospitalized at Mount Auburn. She also works in skilled nursing facilities, seeing patients for rehab as well as long-term care. She is married and has 2 small children. Dr. Burling, thank you so much for joining us. We appreciate your time.
Of course, happy to be here.
What is advanced care planning?
So advanced care planning is really a process by which an individual designates what their medical wishes may be if their health changes at some point in the future. And this really takes several parts. So an advanced care plan involves designating an individual to make medical decisions for you if you could not. And it also involves documenting what those wishes may be if your health changes in the future. And advanced care planning, for the sake of this discussion, is also called advanced medical directives because they're also a set of care plans that may have to do with your financial circumstances at the end of life.
Great. Dr. Burling, what is a healthcare proxy?
So a healthcare proxy is really an individual who would be making those medical decisions for you if you could not. So specifically, if there was an instance in which you were unable to express your wishes, then your healthcare team would be looking to your healthcare proxy for some guidance about what your medical decisions may be. And this term is also known as a durable power of attorney for healthcare. And typically, a healthcare proxy is somebody who is a close family member, like a spouse or a child, also could be a close friend. And it's really important that you discuss your wishes with your healthcare proxy so they're able to make decisions that are informed by your own choices. Great.
I've heard the terms living will, DNR, and MOLST. What do these mean and which ones should a patient complete?
So a living will is generally thought to be a sort of document that indicates your wishes for health care, but it's typically completed by an attorney in sort of a legal document. This is a little different than what's called a DNR form, which most people may be familiar with as sort of a way to designate if you want to be resuscitated or not in the event of an emergency. So specifically, let's say if an individual's heart stopped, was no longer beating, you could indicate whether or not you actually wanted to be resuscitated with CPR. So for example, would you actually want your heart to be shocked with electricity or pumping on your chest to get it going again? And along with that, we also think about what's called do not intubate, which basically means if you went into respiratory distress, if you couldn't breathe on your own, would you want us to put a breathing tube in your throat and put you in a machine to help stabilize your breathing? So that traditional DNR form has been largely replaced by what's called a MOLST form, which is a specific document that was made by the Department of Public Health for the state of Massachusetts. And this is a lot more comprehensive than the traditional DNR form. So specifically, there are ways to think about other decisions about your health care beyond just resuscitation with CPR or a breathing machine. And I appreciate that these decisions are very difficult to be making, and even having this discussion, I'm sure, could be anxiety-provoking for some. But I do think it's an important point to make. To start really thinking about what would be important to you at the end of life. And so this MOLST form really allows for that to be done. And I just want to show you a brief copy of this. In addition to the wishes for resuscitation and intubation, there are also options to put in about whether or not you'd want to be transferred to the hospital if your health was very poor. There's a way to indicate whether or not you would want dialysis, which is basically hooking you up to a machine to clear the toxins from your system if your kidneys failed. There's a way to indicate whether or not you would want artificial nutrition, which is like a feeding tube surgically placed into your abdomen. And there's a way to indicate whether or not you would want IV fluids to be done, say if you had significant dehydration. The other really nice thing about this form is it allows you to sort of give some time limits about these decisions, whereas the traditional DNR form and living wills are typically sort of more general. You can be a lot more specific. So to use an example, let's say if you had to have a breathing tube, you're able to say on this document whether or not you would want that done temporarily. So I often have folks who come to me in the office and say, I really want to give it the best shot to live if there's a reversible medical problem here, but I wouldn't want to remain on a machine for the rest of my life. And so on this form, you can indicate that you would want something short-term only, and that sort of gives your physicians and your the rest of your healthcare team and your family a little more leeway to try something, but not to remain with that course if it looks like the outcome will be very poor.
Great information. When should a patient start thinking about making these choices?
So these are really difficult conversations to have, and I certainly appreciate that. What I would say is that I'd really encourage you not to wait for a crisis to start making these decisions. So I think that it really allows your healthcare providers and also your family to have confidence that they're following your wishes if you've given it some thought in advance. And I also, in some ways, sort of takes the burden off of them because they're following really what you would want done. So I always say, now would be a good time. I have these documents actually for myself, and I'm a number of years younger than most of the people that I see. So I do think that it's important to start thinking about and planning these things now. And the other thing that I know I mentioned briefly before, but just want to highlight again because I feel it's so important, is to make sure that whatever your wishes are, that you're communicating them not only with your healthcare proxy, but also with your team of healthcare providers, and so those wishes can be carried out.
Great. At what point does a healthcare proxy start making decisions?
So that's another really important point as well. The idea behind a healthcare proxy is that it's somebody who is carrying out your own wishes, and so a lot of folks get worried that the healthcare proxy would sort of start making decisions on their behalf and sort of take over their care. But it's really, a healthcare proxy is only activated if an individual can't make decisions on their own. So for example, if someone is unconscious or has an altered change in their mental status, they may be very lethargic or very confused, that would be the sort of situation in which we would rely on a healthcare proxy to start making those decisions.
Great. How does a patient go about getting these documents completed?
So these documents are things that are readily available in doctors' offices, in your local hospital, should be available also at local senior centers, at your attorney or law office locally. But I think, as I said before, obtaining the documents is important, but really giving it some thought about sort of what it is that you would want done. So, for example, really trying to do some soul searching about, what would make life worth living for you. Mm-hmm. So, sort of what are your goals at the end of your life? And for some people, that's a discussion about the length of their life being of utmost importance. And for other people, it's really a discussion about the quality of their life being of utmost importance. And so trying to take those things into account. It's also would be beneficial to sort of think about, if you have any spiritual beliefs that may impact this decision, where you may want to spend your last days, and what really makes life worth living for you.
Great. What should a patient do with these documents after they're completed?
So both the healthcare proxy and this MOLST form, which is what I traditionally will do with my patients these days, are important to have on your, on your person, sort of with your important medical documents. If you keep those in a safe, some folks will even keep a copy, say, on their refrigerator, their back door, in case emergency medical personnel are called to your home, and so everybody knows your wishes. But in addition to having one with you, I'd really encourage you to keep a copy in your primary care office, so it's part of your medical record, and have discussed these issues with your primary care doctor as well. And then it would be ideal for your healthcare proxy to either have a copy or at least to be aware of what your wishes may be. And so the healthcare proxy form is actually a document that looks like this. And again, we'll have a copy of this as part of this video later today as well. So.
Great. Terrific knowledge. We appreciate the information sharing with us, and thank you for your time.
Of course.
Thanks so much.
Thank you.
Bye-bye.
Bye.
Hi, I'm John McDonald. I'm the Director of Social Service here at Care One at Lexington. I'm going to talk a little bit about advanced directives and what the social worker's role is on that. Advanced directives can be a difficult decision for a lot of people, and our responsibilities here are to help explain, support the resident and or the families with advanced directives, and to ensure that their wishes are followed. We're very accustomed to working with people from diverse cultures and different ethnic backgrounds, because those backgrounds can make them hesitant to work with advanced directives. Also important is that we have the tools and the training to deal with people with difficulty expressing themselves and their emotions, and families who are in distress. As I said, like, this is a difficult time for them. We have the healthcare experience, we have the knowledge and the medical terminology to explain it to them. Social workers in all areas of practice can talk about advanced directives to their clients, and in many times we see them in assisted livings, adult day health centers, one-to-one with their clients, senior centers that we discuss, give us the opportunity to discuss those advanced directives with them. We also talk about advanced directives in hospitals, and our primary goal is just to educate them on what those advanced directives are, whether it's a DNR, whether it's do not hospitalize, do not intubate, talking about the MOLST forms for Massachusetts. We also understand the advanced directives in their psychosocial decisions and their medical choices, and we also want to make sure that we follow those medical choices that they make.
We hope to see you next month. Thank you so much. This has been another episode of Learning and Knowledge. We hope to see you soon.